All right, in this video, we're going to go over the treatments for schizophrenia and the schizophrenia spectrum disorders. Now, there are a few things that indicate if someone's going to do well with treatment. One is a higher level of functioning before the first psychotic episode or acute episode. So, someone who's higher functioning is going to tend to do better. Also, someone who has a later onset in life, so someone who's not being diagnosed the first couple of years or very young, but they're older when they're diagnosed, tend to do better. And females tend to do better, but that might be partially because they tend to be diagnosed when they're older. But also, one of the big things with schizophrenia that's really difficult is a lot of people don't have good cognitive insight or understanding, and that their thought process is disturbed or disrupted. However, on average, women tend to have better insight into that than men do. So, for all those factors, women tend to do a little better with treatment than men do. Another big predictor of how well treatment is going to go is the social support that someone has. Also, if someone has schizoaffective, so there's some mood stuff going on, the mood part tends to be treated really well, and we tend to see better improvement. And also remember that sometimes these symptoms can be brought on by severe stress and depression. So if those things are addressed, sometimes we'll see a remission of these, not in actual schizophrenia, because remember, there's depression with psychotic features, which is different than schizophrenia, but addressing those mood problems can lead to a reduction in problems. Okay, so let's talk about the treatments. The primary treatment for schizophrenia is medication. Pretty much everyone who has schizophrenia will be tried on different medications until they find one that does the best for them. We don't have a better way of addressing this. Now, for a long time in the history of psychology, we've just said that we can't talk or therapy someone out of a hallucination or delusion, and I mentioned that in the first video. That's mostly true. There is newer research coming out saying that there are some therapies that we can do that can help uh, people with those to some extent, but the effect sizes or the change we get in those is a relatively small effect size, although it can help some. So we're going to talk about that here in a bit. Anyway, medication is the first line of treatment. We have our first generation antipsychotics, and these medications are really good for getting rid of positive symptoms, so the hallucinations and the delusions, the things that are there that shouldn't be there, and they're good about getting rid of disorganized symptoms. They have little to no impact on the negative symptoms, so the things that should be there that aren't there, it doesn't tend to help with those. Now, if we look at that, 30% of people don't respond. I had a client that we were on her fourth medication trial trying to help figure out what to do, and no matter what she took, she was actively hallucinating every day. Um, so it doesn't help everyone. Of those it helps, most people just get a small effect, but that small effect can sometimes be enough to help them function at a much higher level. And for some people, it works really well. So, like the example of my wife's babysitter, Connie, growing up, it worked exceptionally well for her to get rid of most of her positive symptoms. Now, the problem with this is that most people at some point during their treatment will quit their medication. This is problematic because this is a type of medication that you need to keep a constant level in your bloodstream. It's not like headache pill where you can take one day and then skip 20 days and then take another. It doesn't work like that. It needs to build up to have its effectiveness. And also, the more people go off their medication, the less effective they tend to be. So we don't want people to quit their medications, but people do tend to quit their medications on a regular basis because they have a lot of really difficult side effects, and we'll go through those here in a bit. Okay, so what tends to happen is, generally speaking, when someone has an acute episode of psychosis, frequently they end up going to the hospital. That's a very normal pattern, especially with the first one. And they're given a higher dose, and then after that, they're given what we call a maintenance dose. So the difficult things with these antipsychotics is they have a lot of negative side effects right here. We'll talk about those here in a bit, where these side effects are really problematic and really impair their lives in a lot of different ways. And so people don't like taking this medication. Sorry, where was I going that? So big problem, lots of negative side effects. Oh, so the dosage of the drug. If you get doctors want to get the lowest dose possible to help the client not have symptoms. So it's kind of this balancing act. If you get the dose too low, the person might have another acute episode when they're actively hallucinating or delusional, or having disruptive thought processes, right? So if you get the dose too low, that can happen. But if you get it too high, these side effects are much more common. So it's a balancing act, and this is why treating schizophrenia from a medical standpoint, from a psychiatrist, not a psychologist, is an art form that takes a lot of practice and a lot of effort to get just right, to try to get that right level of medication. Okay, so these are the side effects. Sedation, so people feel tired, they feel out of it sometimes. They can be dizzy, restless, it leads to sexual dysfunction. It also has extrapyramidal side effects, and these can be quite distressing. So it can be anything from hand movements to tremors to a shuffling gait. You can also have tardive dyskinesia. I should find you a video of tardive dyskinesia. So just a second, I'm going to pause and find a quick video example. All right, I found a good example of it, so here we go.
In the mirror. And then the puffing in and out changed to grimacing, and I wasn't surprised that I was diagnosed with tardive dyskinesia, TD, because I knew grimacing was one of the symptoms, but I was surprised. I started to have other physical problems that I wasn't prepared for. TD has had a big impact on my life. My symptoms of TD are very visible, and as a result, people look at me differently. I travel by public transportation, and I have kids turn around and stare at me because they're curious or they don't understand why this man's making faces. So I don't get upset about that, but it does upset me. When people see me grimacing, they come to the conclusion that there's something wrong with me. I also dealt with discrimination. Several times when I went with a friend into a restaurant, the hostess or the host escorts me to this more dining room, and they do that to keep me away from most of the patrons. I'm very saddened that there's people who have TD, and because of their movements, they're embarrassed to be around other people.
Okay, so you can see that's a very difficult side effect from this medication. There is new research on some new medications that can lessen it, but that's still being developed. So with that all being the case, these first generation antipsychotics have actually done wonderful things for people. I don't want you to hear this and go, oh, these are horrible medications. Before this, frequently when people were diagnosed with schizophrenia, they would end up in the hospital permanently. They could never leave. They'd live in these residential treatment facilities in deplorable conditions. And really, the onset of these antipsychotics was a huge blessing historically for a lot of people's lives. But even for those who it's helping and helping them function, it tends not to fix everything to an extent to where that a lot of people still can't live independently, but it does tend to help quite a bit. All right, so that brings us to the second generation of antipsychotics. The second generation of antipsychotic medications, when they first came out, were touted as being far superior to the first generation, that they had way less side effects. Research has come out on them more currently is suggesting that that may not be the case, and that's probably just an artifact of the drug companies themselves doing the research, right? So they obviously have secondary motivation to report less side effects. But they are equally as effective as first generation at reducing positive symptoms and disorganization, so they do just as well. But they also show, according to some research, modest help for the negative symptoms. Other research says not so much. So there is some debate on that front, but it might be helping a little bit with the negative symptoms. more effective at improving cognitive functioning though. So overall, it seems like the second generation of antipsychotics are a little more beneficial than the first generation, but they still have the unpleasant side effects that the first ones do. For a long time, they were saying they didn't have these extrapyramidal ones, so it wasn't leading to the shuffled gait and the Parkinson's-like symptoms that we see, extrapyramidal side effects of the first generation, but current research is showing that they have just as many extrapyramidal side effects. So also, the big downfall of these ones is they tend to lead to weight gain, which can lead to heart disease and diabetes and all of that. I had a client, another client that I was working with, who it was his third medication trial that they tried Geodon, and Geodon is a second generation antipsychotic, and it worked beautifully for his psychosis, which was really great. But then in the 9 months following his stay in the inpatient hospital, when he had an acute episode and we got him on medication and all that, he gained, I don't know how much weight, but it was a lot of weight, right? And so it was very unhealthy from that standpoint. And then the question becomes, well, what do? Do you die from obesity and diabetes and heart disease, or are you non-functioning from being actively psychotic and not being in touch with reality? So it was really difficult. It's difficult for people to decide what to do. Okay. Many people also stopped taking the second generation medications. African American clients tend to not be prescribed them as often as first generation antipsychotics, demonstrating some bias in how doctors are practicing. All right, so here's the full list of the two different, the first generation drugs and the second generation drugs. We're now coming out with some what we call atypical antipsychotics, which don't work necessarily in the same way, and they're in the developmental phase. So anyway, a review of over 60 years of clinical trials, just over half of people with schizophrenia had a minimal response compared to a placebo. So a lot of people, it's effective in getting rid of their acute episodes. It has some mild effects, but only 23% of people who have schizophrenia do really, really well on these medications and have a good response. Even though these drugs work better than placebo, they do not work well for all people. So when it comes to medication, we definitely need more research and development on medication. So the current standard of care for someone who has schizophrenia is medication and therapy. Now, there are several different therapies that have been shown to be effective. So we're going to talk about those. The first one is social skills training. Social skills training is exactly what it sounds like. It's helping someone develop social skills. How do you complete a job application? How do you run a schedule? How do you budget? How do you do all these things? Now, for some people, they already had these skills, and it's relearning the skills if they've lost them. Some people who have schizophrenia never had these skills to begin with. So, and a lot of these things seem like common sense to the rest of the world. How do you make an appointment? How do you keep an appointment? Those type of things are easy for a lot of us to do. Individuals who have schizophrenia frequently have to practice these things, and they practice them over and over in a therapy setting in order to be able to do them in real life. So that's an effective treatment. It involves role playing in groups, individually, and also in vivo, so in real life situation. So people who have the social skills training tend to have fewer relapses of acute time periods of being actively having positive symptoms. So they tend to function better, they have a higher quality of life, it improves their life significantly. Let's see, the next one is family therapy. Family therapy, what you're trying to do is reduce expressed emotion. So a lot of times families don't know how to cope with someone who has schizophrenia, and they blame themselves, and they be very emotionally reactive to the person who has schizophrenia, and sometimes very negative with them. The greater amount of expressed emotion they have in those ways, the worse the outcome is for the patient. So a lot of this comes down to education and helping the family understand how to support someone, right? So the things that happen in these family therapies are, one is education about schizophrenia. The family needs to know it's not their fault. The client needs to know it's not their fault. The family needs to know that it's not the client's fault too, so they're not blaming them. They need information about the antipsychotic medications, and they need to understand that even though the side effects are difficult, for a lot of people, the side effects, it's better to have those side effects than to be have all the full-blown symptoms of schizophrenia. We want to reduce blaming, right? Communication and problem-solving skills within the family. The family needs ideas of what to do. It can be very difficult interacting with someone who has schizophrenia on a day-to-day basis, and when their thought process might be paranoid or whatever the case may be, and it's not making sense to the individual, problem-solving can be very important. Social network, the greater the social network for the person who has schizophrenia, the better they tend to do. So improving that social network and expanding that social network. Unfortunately, what tends to happen with people who have schizophrenia is their social networks tend to decrease over time. In that example video, we saw the individual has tardive dyskinesia, and you can see how a lot of people would be turned off by that. So they quit interacting with them, and people's social skills shrink. Even if they don't have tardive dyskinesia, all these other symptoms of schizophrenia can make it difficult. And that's not to say that that's right, that people should avoid someone with schizophrenia, but you can see how that happens. And so it's very important that we work on expanding that social network. And finally, instilling hope, which honestly, because of the long-term nature of schizophrenia being a disorder that people really tend to not recover from, it can be difficult to instill hope. But at the same time, it's important that the families understand that there are supports out for them. So if you look at some of these really great treatments, what they're doing is they're not just doing the therapy piece and the medication piece, but they're also bringing in a social worker to help the family understand what services are available to help them, which can also be very important. Now, this is the section on cognitive behavioral therapy where we help people start challenging their delusional beliefs. Research suggests that this has a small effect on people, meaning it can help. Again, what's kind of going to predict how helpful this is, though, is the cognitive functioning of the person. So people who have higher cognitive skills tend to benefit more from this. So that kind of goes to the next one where next treatment that actually focuses on retraining cognitive skills, but someone who has good cognitive skills can challenge their delusions to some extent. But frequently what's happening is they're reattributing their delusions. So the delusions don't go, but with the therapist, they modify their delusion to something that's not so disruptive for their life. And that I've done that with multiple clients. Reduces negative symptoms. So challenging belief structures tied to low expectations for success and pleasure. Okay, currently most effective treatment. So let's see. This one, cognitive behavioral social skills training. So this is where we're starting to combine all these different skills, combine social skills training and cognitive behavioral therapy, focuses on reducing symptoms and improving functioning. Okay. Earlier treatment, better the outcomes. That's pretty much for every disorder, right? We just put that on every slideshow. Okay. So cognitive remediation or cognitive training. This is where we try to help clients regain cognitive skills. It's computerized. It's based to help them improve their memory. So if you go back to the etiology of schizophrenia, we can see reductions in the hippocampus, which is associated with memory. So this is helping retrain some memory skills. It helps with some problem-solving skills that may have never been learned or may have been lost, so it helps get those problem-solving skills in place, and it can train attention. And so by doing this, someone's able to cognitively process better. So these cognitive behavioral therapies, we're more successful in helping people recognize and challenge their delusions or reattribute their delusions to a healthier way of thinking. Psychoeducation, this is when we teach people about their psychological disorder. It's very important for all disorders, but especially important for someone with schizophrenia. Just like with other disorders, what sometimes happens with people who have schizophrenia is they start taking medication, they start feeling better, so they quit taking their medication. It's one of those conundrums in life. So it's important that people understand what's coming, they understand what to expect, they understand the side effects of the medication. Yeah, and the more we can do this psychoeducation, we can reduce the number of times they have to go back to the hospital. One of the big things that therapy in general, but especially psychoeducation does, is it increases medication compliance, which is very important for many individuals who have schizophrenia. Residential treatment. This is when they have to be in the hospital, but more often what we're talking about when we talk about residential treatment is more of a group home type setting. A lot of individuals who have schizophrenia have too severe problems to live at home, or the home no longer has resources to help take care of them. So frequently they'll live in these residential settings. These settings vary in quality immensely. Some of them will have their own business structure in them. They can do a lot of different things for individuals. They can help with vocational rehabilitation, so learning of skills so people can be productive. Residents learn marketable skills, increase community functioning. It gives them also those connections. So residential treatment is very important, which leads us to your last option for an activity. Activity 3, find a research article that evaluates the efficacy of residential treatment, or a specific aspect of residential treatment. So it doesn't have to be all of residential treatment. It could be a specific thing done in residential treatment. So just find a research article, give us the APA reference, and summarize the findings. So that's your activity number 3. Again, remember to have compassion for people, an exceptionally difficult diagnosis, but if when treatment goes well and people do things the right way, people can live a functional, happy life. So yeah, that's everything I wanted to cover with schizophrenia. Let me know if you have any questions, and have a good day.